Good afternoon, and thank you for joining me for our weekly COVID-19 update. Before I get started on the update, I might as well tell you about my new fashion accessory, a little cast. I was out walking a week ago tonight and unfortunately got tripped up by a dog. Just an accident, and I have a little fracture in my wrist, but all's well. It's very minor injury, so just wanted to let everyone know because there may be some questions why I'm wearing a cast. I would like to, though, today to start with our census update. The 2020 census, as we know, is extremely important in terms of the funding that the county and this whole community gets for a multitude of projects and initiatives. The response numbers for this week are 70% of households within Erie County have completed the census, so we have 30% who have not. And then in the city, which is of course part of the county, 61% of the city of Erie. So lots of people we still need to get to respond to the census. Complete that census by calling 844-330-2020 or go online at my2020census.gov today. And also, if you don't have access to a computer or struggling with it, there'll be census workers available at Gridley Park in the city of Erie tonight from 4 to 6 p.m. and tomorrow in front of the Erie County Courthouse on West 6th Street from tomorrow and Friday from 10:30 to 2:30. They have iPads there. You can fill out the census less than 10 minutes, be done with it, and help us make sure, again, that we get the federal dollars flowing into Erie County that will happen for the next 10 years based on this census. And now for an update on our COVID-19 situation in Erie County. We have 7 new cases of COVID-19 to report in Erie County as of 12:01 a.m., which brings us to a total of 747 cumulative positive cases since March. We currently have 624 recovered cases and 108 active cases. There's been 14,027 negatives, and we have a total of 15 deaths. Of the cumulative cases in Erie County, 59% are female, 41% are male. The breakdown by age is 4% from 0 to 4, 2% 5 to 9, 6% 10 to 18. 14% are 19 to 24, 41% from 25 to 49, 20% from 50 to 64, and 13% are ages 65 and older. Regarding race and ethnicity of our cumulative cases, 55% are white residents, 30% are African American or Black residents, 5% are Asian residents, 2% are other, and 7% are unknown. Regarding Hispanic origin, 10% are Hispanic of any race, and 82% are not Hispanic, with 8% unknown. We all must continue to wear our mask and physically distance ourselves and practice that good hygiene that we've been talking about for months now. Please stay away, of course, from anyone who is ill until they have been tested. I understand religious institutions are happy again to offer in-person services so that we can all worship together if we so desire to. But please keep in mind that masks are essential because those gatherings put attendees at a greater risk than many other activities of spreading COVID-19. Research shows that mask wearing does help immensely in stopping the spread of COVID-19. We've just learned that Walmart will be requiring all customers to wear masks beginning next week, although that has already been a requirement within the state for quite some time. And so now I would like to invite Melissa Lyon, the director of the Erie County Department of Health, to share a quick update from the Erie County Department of Health. Melissa?
Thank you, County Executive. I'll keep my talking points brief. I understand that there has been an increased interest in COVID-19 testing and testing sites. So I'm here to remind you that the Erie County Department of Health does not offer testing, nor are we currently involved with the coordination of testing sites. The health systems are the local lead on COVID-19 testing at their facilities and their off-site locations, 2 of which are here today and will be talking more specifics about their testing. The other sites in Erie County are coordinated through the state and the federal contracts. And those sites include the 3 Walmarts, which would be in Edinburgh, the Walmart located in Elm Street in the city of Erie, and West Ridge Road. There's also a CVS on Sterretania Road and Rite Aid at 5430 Peach Street. Please know all of these locations require an individual to complete a pre-screening questionnaire and also to schedule an appointment. Hours of operation for each location and links to an appointment scheduler appear to be available using the Pennsylvania Department of Health Interactive Site Locator Map. That can be accessed through the Pennsylvania Department of Health's website. The Mill Creek Township Urgent Care Center, also known as MedExpress, is also listed on that website, and they are accepting patients for COVID-19 testing. What I really want to remind everyone is just how important it is that you quarantine if you get tested until you receive your test results. So I want to repeat that. If you are tested, you must quarantine until you receive your test results. What that will do is it will minimize the number of contacts you will have come in contact with if your results come back as positive. Quarantine means that you will remain in your home or residence, preferably separate from all household contacts. That means you cannot move around the community, such as shopping, working, or socializing. Should you have to interact with your household contacts, you must wear a mask at all times when interacting with household contacts. There was one other question recently that's been getting a lot of attention, and that's the quarantine after travel. And so there was a governor's order that came out around quarantine, and weekly updates on the states that you must quarantine from are available at the governor's website. They will be updated weekly, and as of now, I believe there are 15 states. So again, for 14 days, we ask that you stay at home, you stay quarantined with household contacts if they traveled with you, and not move around the community. That would be not shopping, not going to work, not socializing. And that's to help contain the spread of disease in Erie County. With that, Kathy, I turn it back over to you.
Thank you, Director Lyon, and I'm also happy, as Melissa mentioned, to welcome Dr. Chris Clark, President and CEO of Allegheny Health Network, St. Vincent Hospital. And so, as well as Emily Shears, the Director of Infectious Prevention, Quality Improvement, Regulatory and Accreditation Services at UPMC Hammett, to provide updates and testing from their facilities. And Dr. Clark, I'll have you go first, please.
Okay. Thank you, Kathy. I'm pleased to provide an update and report on how things are going at AHN St. Vincent. We continue to test patients for COVID disease by physician order at one of two locations, the hospital and the tent testing site outside our West Side Health and Wellness Pavilion in Mill Creek. We do not routinely test patients for COVID without symptoms, though. Tests are either being processed at our in-house lab at the hospital or through Quest ACL in Erie. To date, we've tested almost 3,600 patients with 183 coming back positive. The positivity rate for those tested has actually dropped to 5.1%, and it peaked about a month ago over 7%. We've hospitalized 55 patients to date, and we currently have 2 patients in the hospital with COVID disease right now. The return to traditional utilization has gone smoothly. We continue to perform extensive screening of our patients, though, as a part of the process, and our facilities are safe and clean. Any care delivered to COVID patients is done separately from all other patients in either the emergency room or throughout the hospital. Of course, we use masks and now shields exclusively, and our PPE supplies are good. We allow for 1 support person visitor per patient with few exceptions. We are watching the numbers of COVID activity and what is going on in Allegheny County specifically very closely. We maintain a constant state of readiness at AHN St. Vincent. And like's been said, but we can't say it enough, I do want to take this opportunity to reemphasize the importance of everyone's role in preventing the spread of COVID-19. Please wear a mask to protect others. Avoid congregating in groups and keep your distance from others to more than 6 feet when possible. Thanks for all the great work that's being done by the caregivers in this community, throughout the entire community. And of course, I want to thank Kathy for your leadership as well and the opportunity to speak to everyone today.
Thank you so much, Dr. Clark. And now we'd like to invite Emily Shears from UPMC to speak.
All right. Good afternoon, everyone. Thank you, Kathy, again for inviting us to be part of these important briefings for the community. So currently at UPMC Hammett, we are taking care of 6 patients with active COVID disease, two of which are in our critical care unit. The other 4 are being treated for in our negative airflow COVID dedicated unit. And we do remain very busy, safely providing necessary care to all of our other patients. We've continued to provide specimen collections at our fully negative airflow collection center, which is located downtown Erie at 150 West 3rd Street. We do require an order for symptomatic patients from a medical provider to schedule the testing and aren't able to accommodate walk-ins at this time. The collection center collects an average of 75 COVID specimens a day. And since opening on March 24th, we've tested 4,642 individuals, and our positivity rate for 198 positives is around 4.2. We have also completed 1,645 screens of asymptomatic patients in and out of the hospital that are either going for surgery or a procedure, as well as those being sent to nursing homes. All of those tests have been negative. Patients that require testing are contacted and scheduled by our team here at UPMC Hammett, and our testing is offered Monday through Friday from 9 to 4:30 and Saturday from 7 a.m. to 11 a.m. I also want to thank all of our support staff, patients care staff, nurses, physicians that have really been providing a very high quality and compassionate care during this pandemic. We also want to remind everyone in the public that masking is important, social distancing, limiting large events. And then as we move into flu season in the fall, please cover your cough. And again, making sure you're following all of those common sense practices. So thank you, Kathy.
Thank you, Emily. And I want to thank our health systems. Thank you for being with me today, but thank you for your partnership throughout this entire COVID-19 pandemic. The collaboration that has gone on between the healthcare systems and the Department of Health and so many other partners in this community, I really believe has made a huge difference in COVID-19 incidents within our community. And now we're going to open it up to media for questions. Because Governor Wolf is holding his press briefing at 3:30 today, we're going to limit our questions to probably just 2 rounds, and we're going to be off the air by 3:30 so we can listen to the governor and Secretary Levine in their press conference at this point. So now I'd like to open it up to Erie News Now first.
Hi, good afternoon. Speaking of the governor and Secretary Levine, are you aware of what we're expecting to be announced here in about 15 minutes in terms of restricting alcohol sales, limiting indoor dining, that sort of thing, and your thoughts on these further restrictions that are likely coming our way?
So I have gotten word that that is going to be part of his message going forward at 3:30 today. The one thing I do like about this is consistency across the Commonwealth. I think when we have varying degrees of what can be open and what cannot and what can happen across the Commonwealth, it gets very confusing for our residents. I think every one of us who has spoken today has been watching what's been going on in Allegheny County very closely, and it's very concerning to us because we know that many people from Allegheny County and many other places across the Commonwealth come to Erie County, particularly at this time of year, for our beaches and our water and so many of our great assets here. So I think it is a good thing that we have these restrictions in place across the Commonwealth. And Melissa Lyon, I don't know if you want to say anything further about that.
Thank you, County Executive. I don't have much additional to offer at this time. We're looking forward to hearing what the governor has to say and any additional guidance that will be coming moving forward. If it is within our restaurants, we have the appropriate staff that can help support restaurants as they navigate through whatever the announcement is today with the governor. Thank you.
And Kathy, just on the flip side of that, your message to business owners who are preparing to perhaps take another hit here.
That is the really downside of this, of course, is the economy and our businesses that we know so many of them, particularly in our hospitality area, are struggling. Tourism, hospitality, and we want to be there to help you. So one of the things that hopefully will be happening here very shortly is the $24.3 million in CARES funding that's coming to the county. We are setting aside a large portion of that money for grants. This is not a loan, grants that can go to our businesses, and there's going to be a specific, again, large amount set aside for those in the tourism hospitality arena in particular. So the details of that will come out after hopefully County Council passes the ordinance that will be in front of them next Tuesday. And so I know it can't get out there fast enough, and I know for many businesses this is a huge hit, and it is a huge concern of ours.
Thanks.
Sure. Erie Times News?
Yes, Kathy, it's David. We've seen low numbers for most of the last few days, other than yesterday's 22 cases. One of your staff was kind enough to send me information that these were not related. Yesterday's 22 cases weren't related to a long-term care facility. But what caused that peak yesterday, in your understanding? Was it July 4th? Was it delays in lab testing? You know, what led to yesterday's spike in numbers?
Well, my guess would be it's July 4th. If you go back to Easter, Mother's Day, Memorial Day, Father's Day, every time we've had a holiday where people tend to gather together with their family and their friends, we have seen a spike in our numbers in Erie County. And it was interesting on Monday when we had a very low count and had a low count for quite a long string of days. The mention was made, I wonder what tomorrow's going to bring, because it's 10 days past the 4th of July, meaning Tuesday. So I think much of that probably was just because people gathered in those gatherings that we love to do, but that really are not recommended and truly shouldn't be happening at this particular time. I don't know if Melissa wants to say anything further about that.
County Executive, you've been well briefed throughout the pandemic, and you've answered that question just as I would have. So well done.
I have a great staff, but yes. So go ahead, David.
Sure, Kathy. And just to follow up, you know, with the cases back down to a single digit today, how encouraged are you that this it hasn't been at least a string of days above 15 or 20 cases? And what, you know, I guess I'm asking you to predict a little bit. Do you think this is what we might see at least for the next few weeks?
Well, I wouldn't be surprised if we see another big day tomorrow or another day. I don't think the 4th of July numbers have completely, come in. So we'll have to wait. None of us have that crystal ball we've always talked about. We wish we had. But I have been extremely encouraged by the lower numbers, thinking that our community continues to try to do well. Our businesses and other places where people tend to gather are trying to do the best they can. And again, I just ask the people of this community to continue to do what we've been asking them to do, and hopefully we can get back to, again, low numbers going forward. Joel Natale, are you with us at Talk Erie?
Yes. Hi, Kathy. This question is for Dr. Clark and Ms. Shears. Just to try to get some perspective here, with 6 cases at Hammett, 2 cases at St. Vincent, what kind of category of disease would be dominating your critical care areas, and how many patients would that represent? Just so that we know where kind of COVID ranks in terms of the busyness of the hospital.
And just a quick clarification question. Is that specific to the COVID patient, the typical COVID patient that we're seeing?
No, I'm actually asking about censuses. Would it be heart disease? Would it be accidents? Would it be gunshot wounds? What would be the most dominant category of inpatient care as opposed to, let's say, COVID? Is there 100 people with heart disease versus 2 people with COVID? You know what I mean?
I'll answer first. I think you called me out first. So from our perspective, AHN St. Vincent is definitely seeing near normal hospital numbers for non-COVID patients. So it is more of the typical types of things that people need to be hospitalized for. So cardiac conditions, heart attacks, strokes, infections of other kinds that can lead to sepsis. Those are the types of conditions that we're seeing in the hospital, much like we did prior to the epidemic. So nothing unusual, if that's part of what you're asking about too, nothing that stands out that's related to COVID, meaning that we're seeing an unusual type of condition, or a condition that's more likely because of the epidemic. It's more of the usual kinds of cases. And like I said, very close to the typical numbers that we see, particularly this time of year.
And Dr. Clark, what would be those typical numbers? Is that 100? Is that 50 for, let's say, a cardiac patient?
Well, I'd be just sort of doing the best I can with guessing.
Anecdotally, yeah.
Yeah, I mean, percentage of cardiac conditions that we have in the hospital, could be anywhere from 10 to 20%. We certainly have people coming in for elective procedures, joint replacement. That's very much normal numbers. Back surgeries. So cardiac 10 to 20%, infections 10 to 20%. It's a pretty good mix, and we see a variety of cases like we typically do. Hopefully that helps.
Thank you.
Sure.
Would you like to answer next too?
And as far as UPMC Hammett, just to echo Dr. Clark, we are seeing very normal census. Our COVID patients represent less than 2% of our total admissions. And really being a tertiary care center, we're seeing, our usual traumas, strokes, regular scheduled necessary surgeries across the board, as well as the other, cardiac conditions, infections, sepsis, et cetera. So pretty routine care, routine admissions that are ongoing.
So just for clarification, Ms. Shears, and I'll get off, but let's say for 20% of your census is about 80 to 90 patients versus the 6 COVID, correct?
Our current census is over 400 patients. And so obviously that's changing day to day as discharges come in and admissions come in, but our COVID admissions are less than 2% of our total, which is over 400 patients in the hospital right now.
Thanks for your patience.
Sure.
Thank you. Jet TV.
Good afternoon, Kathy. It's Star. You said earlier that it's appropriate that the Commonwealth is being consistent, but what is your concern for Erie County, as this could be another major setback for businesses and even tourism?
Well, as I said, I think that it's obviously a huge concern. I know our businesses, many of them are still very much struggling, and this is a hit to those businesses. I think what could be even a worse hit is all of a sudden we did have such a huge spike like Allegheny has had, and we would have to even shut down more than this, what we expect the governor is going to announce here in a few minutes. So again, this disease, this virus is serious. People are having serious complications because of this virus. We have to get it under control. We all have to do our part. If everyone would just wear their mask and stay their social distance away from people and not gather in large groups, we'd do much better. So I understand the Secretary of the Department of Health and the governor's huge concern for the Commonwealth. They're trying to save lives. They're trying to get control of this virus, not only within the Commonwealth, but honestly within our country. When you look at the United States, there really aren't many countries doing worse than we are in terms of controlling the virus.
Thank you.
Sure. We'll go back to Erie News Now.
Hi, a question for you about this past weekend where we had the lacrosse tournament with teams in from all over the area. Were you aware that was happening, and do you have any lingering concerns coming out of that?
I was not too aware of the lacrosse event, and I'm not sure if Melissa Lyon has anything to report on sports teams. I know our health department has been working somewhat on that issue. Melissa?
Yeah, I don't have anything to report specifically around the lacrosse tournament. Not that I would have been aware. Tournaments can happen throughout the county without needing any type of county health department approval. What I can say is we've been working with our athletic teams and athletic organizations to help them navigate the guidance on when to wear masks, who needs to wear masks, and wearing masks when in play. Very, very challenging questions, and we've been working as closely as possible with those athletic teams and associations and organizations so that they can make good choices for their athletes as well as the parents of the athletes and as well as the spectators. So We know that it's a very difficult time right now, and the health department really is doing their best to help everyone navigate what that guidance looks like. Thank you.
So just so I'm clear on this, no one, on the county level really was tipped off to this. And if I wanted to host, say, my own tournament and bring in 150 teams from the Northeast, I could do it. There'd be nothing stopping me.
Well, again,
I mean, there still is the gathering requirement of, less than 250 people. There's also occupancy requirements. So again, the guidance is not a one-size-fits-all. When we are aware of potential events that may not be falling within those guidance documents, we do everything in our capacity to reach out and help them navigate through that. I hope that answers your question.
Thanks.
and from what I understand of the guidance, masks need to be worn by everyone. There's very few sports in which they are not required. So again, it's hard to keep your 6 foot distance in most sporting events. But I have myself seen baseball games going on where coaches don't have masks on, parents don't have masks on, people in the dugout don't have masks on. I mean, that's got to change. And we need everyone to understand that if we're really going to control this virus. Okay. I guess next would be Erie Times News. David?
Yes, Kathy, you had talked about places of worship early on in this news conference. Want to have you elaborate on that? Have you been getting reports about churches not following the guidelines? And I believe they're not required to, correct? Because they're churches and other places of worship. But what have you been hearing, and what are your concerns about that?
Sure, there is a separation of church and state. Our churches have been very cooperative throughout this, but we were just getting some reports in that there was some places of worship that weren't requiring people to wear their masks once they were in the facility for the service, and that the recommendation is that they wear masks the entire service. Singing is very dangerous. They shouldn't be singing, and even when you're speaking, you think about everybody collectively saying something like "Amen." It's usually done with gusto, and that just spreads that virus out further. So again, we would really hope that every religious organization, when they're having services inside, particularly, but anytime they're gathering people, would require everyone to keep their masks on during that entire service. And now,
Thank you.
Sure. Now we'll move on to Joel. We're going to quickly finish up here.
Sure, Kathy, really quick to you. Do you think it's appropriate for the government to pick winners and losers of businesses when these hospitalizations and mortality rates are so low in Pennsylvania?
They're low now, but they may not stay low. And I think that's, again, something that I'm going to leave to the experts. And I don't know if, Dr. Clark, if you want to weigh in at all just about the virus itself, or I guess since I have you here, I'm going to call upon you.
Am I still muted?
No, you're on.
Okay. Well, I mean, nothing specific to add. It's definitely a tough call, and to balance the safety mechanisms, measures that the government's trying to put in place. That's why ultimately it falls down on us as citizens to do the best job we can to follow the guidance, and for businesses to be, I guess, creative in meeting the expectations while still running a business, running operations. So the good news, I guess, is from our experience is that it seems like we're seeing less hospitalizations, and we do have more that we're doing to manage patients too. Younger people are the reason why that is the case. Most likely, younger people have less risk for complications, therefore are less likely to need hospitalization. So that's why that's the experience that we're seeing. But we, as mentioned, we cannot take our eye off the ball here. We have to absolutely be attentive and follow the guidance so that we don't run into a problem in the future.
Thank you, Dr. Clark. And real quick, Star, do you have a last question? Because it's just about 3:30.
Sure, Kathy, real quick, your initial reaction to hearing that the PSAC is canceled, that's the fall sport, or the sports for Edinburgh, Gannon, and Mercyhurst, how that's going to affect the universities and our county.
Obviously, extremely disappointing for those athletes and for those universities, but I think it's the right call to make. And with that, I'm going to thank everyone for being with us again today. Stay tuned for the governor and his press briefing. And again, please stay as close as you can to home. Keep your mask on when you are out. Stay healthy throughout this, and stay calm. Appreciate it.